Welcome everyone to the NOAA webinar series. Our subject today is Hermansky-Pudlak Syndrome, or HPS. We're very fortunate to have with us today Donna Appell. Donna is a registered nurse and serves on the NOAA Board of Directors as well as NOAA's Board of Scientific Advisors. The mother of a child with albinism, Ms. Appell is also founder and president of the HPS network. She is the immediate past chairperson of the Public Advisory Roundtable of the American Thoracic Society and serves on their Patient and Family Education Committee. Ms. Appell is a member of the New York Mid-Atlantic Consortium for Genetic and Newborn Screening Services, working on transition healthcare issues. She was also recently appointed to the Council of Public Representatives, an advisory group that works directly with the Director of the National Institutes of Health, Dr. Francis Collins. Her past clinical experience included a 22-year stint in an intensive care unit, and Donna lives with her family in Oyster Bay, New York. We are very happy to be able to present Donna today. She is an inspiration in her commitment to the condition of Hermansky-Pudlak Syndrome, and we have a great presentation for you, and we really appreciate Donna. Take it away.
Thank you, Mike, and thank you, NOAA, and thanks for being able to do this. I'm excited for this webinar because I really think that information about Hermansky-Pudlak Syndrome is important for all people with albinism to either help yourself or our community at large. So I hope that this provides some information and kind of reaches all comers. Some of it will be not deep enough for some or not as interesting for others, but I hope that it gives you an overview of what Hermansky-Pudlak Syndrome is and the reasons why you might want to consider and think about Hermansky-Pudlak Syndrome, which brings us to our first slide. Why should I learn about HPS? Well, in my opinion, I really think that everybody that is working with the albinism community, whether you're a parent of a child with albinism or an adult with albinism yourself, should actually learn about HPS because it might apply to you personally or it might apply to somebody that you come in contact with. And I do believe that we are a beautiful, wonderful community, and therefore we should help one another. So I think learning all there is to know about albinism and the albinism issues can only help us be a stronger and more safe community. So one of my big issues about why I think everybody should learn about HPS is because of the danger of not knowing. So I have to say that I kind of worry about the children that are being born with albinism that might not have pediatricians that understand Hermansky-Pudlak Syndrome, because I really would prefer that people have an idea of what HPS is and what to look for the reason that Hermansky-Pudlak Syndrome, and we'll talk about that in subsequent slides, causes a bit of a bleeding disorder, and products that can actually affect that bleeding disorder and make it worse are given very frequently to young, children. So baby Motrin, for instance, for a fever that is not being handled with just Tylenol, is prescribed frequently and given to our kids. And if a child has Hermansky-Pudlak Syndrome, it can affect their platelets and the bleeding disorder even more. So that is not going to be a kid that you're going to want to give Motrin, baby Motrin to, and therefore I really think that our children should be screened for Hermansky-Pudlak Syndrome so that we would be able to understand the dangers of medications that cause platelet defects, platelet problems. I also believe that because of the possibility of preventive health management is a great reason why you should learn about HPS. Yes, to date there is no cure for Hermansky-Pudlak syndrome, but there certainly is things that you need to know about if you should have HPS. Things that can keep your lungs more healthy, things that can help you stop bleeding. So there are definitely health management issues that, should you have HPS, would be helpful. Also, the issue of not signing up for surgery if you didn't know that if you had a bleeding problem. So these are all reasons why I absolutely believe that everybody in the albinism community should think and learn about Hermansky-Pudlak syndrome. And we're going to talk about this at the end of the slides as well. So I kind of wanted to cut to the chase and say, well, why should you even listen? And we'll review this again, and I hope that it will touch on your thoughts, and maybe we can have a discussion about this sometime. So Hermansky-Pudlak syndrome was a disorder that was first identified in 1959 by a Dr. Hermansky and Dr. Pudlak. It was 2 cases that were reported in a journal, and they discussed 2 cases of people with albinism, and they had a bleeding disorder. That being said, they decided to name it after themselves, and thus it became Hermansky-Pudlak syndrome. Dr. Markello, who's a wonderful researcher at the National Institutes of Health, did some research, in history on HPS, and found this other interesting in 1924. So this is back even further in the Proceedings of the Royal Society of Medicine. The story of a family that had albinism and diagnosed with hemophilia. So we often wonder, and he suggests that maybe Dr. Hermansky and Dr. Pudlak did not find the first cases of HPS or report on them, but maybe the report goes all the way back to Dr. Firth in 1924. But that's not exactly, where the story started as far as the naming of it goes. So Hermansky-Pudlak syndrome is autosomal recessive. Autosomal recessive means that it is most likely to have occurred in both parents. So it is that story of 1 in 25% chance of each conception having a child with HPS, a 50% chance of having children that are carriers, and a 25% chance of having a non-affected child and a non-carrier. Autosomal recessive genetic inheritance is exactly the same in HPS as it is with all types of albinism except our X-linked. So autosomal recessive is the most likely cause. I say likely because in everything that I've learned, you can never say never in genetics. So there are those, unbelievably spontaneous mutations that can occur in families, and in the world of genetics and science, I truly try never to say never. So it's presumed to be most often autosomal recessive. Presently, there's HPS 1 through 9. Actually, HPS 9 was just published last month. So that means that there's HPS 1, HPS 2, HPS 3, HPS 4, all the way to HPS 9. This means that at this moment there are 9 different genes that cause Hermansky-Pudlak syndrome. So let's stop there and think about this. If you actually have had gene testing and had your genes figured out with your albinism or your child's albinism, and they were able to say to you that there was an albinism gene like OCA1 or a gene that caused the albinism, then most likely you do not at all have Hermansky-Pudlak syndrome because the genes are entirely different. So it's not a matter of that you have a gene that causes the albinism and Hermansky-Pudlak syndrome. It's one or the other. I often think of it in my head that genes that cause a deficiency in tyrosinase in the pigment production because of the enzyme tyrosinase are like the pigment genes. Hermansky-Pudlak syndrome is a gene that causes a defect in a number of problems. It causes the albinism, the bleeding problem, and more things as we go through these slides. But albinism is not the only symptom of this disorder, which is why it's called a syndrome. When things are a syndrome, it means that more than one thing is going on at the same time. So to me, it's kind of like a secondary albinism. It's caused by the Hermansky-Pudlak syndrome. So you either would have a pigment gene primary type of albinism, or you have Hermansky-Pudlak syndrome. They're all different genes. So when people do call me, I ask them, have you ever had any gene testing? And if they can answer me, yes, I'm OCA type 1, and I'll ask them, who did, was that testing absolutely done molecularly and genetically? Then they would actually be kind of excluded from having Hermansky-Pudlak syndrome. Usually. Remember, we never say never in genetics, but usually that would mean that they do not have Hermansky-Pudlak syndrome. So here's the parade of our mouse models. We have quite a number of them, and this is to point out that we have HPS 1 through 9 as identified in people, but we have more than that identified in mouse models. So naturally occurring mice, we have genes that are up to, I do believe, but don't quote me, like HPS 14, like 14 different mouse models. And therefore, we expect there to be HPS genes that have yet to have been identified. What does that mean? That means that there are people that have Hermansky-Pudlak syndrome based on a diagnostic blood test that we're going to talk about that do not have HPS 1 through 9. So in all intents and purposes, it might not be the best idea to do gene testing for Hermansky-Pudlak syndrome unless you are of a particular nationality. It might still need to be a blood test because all of our genes have yet to have been identified. And you'll see that a little bit more clear as we go on. HPS probably occurs in every nationality. I mean, we have people with Hermansky-Pudlak syndrome from all over the place. So here is a list of countries in Commonwealth that are actually, people and members of the HPS network. So these are actually people that come from these places that have Hermansky-Pudlak syndrome. And we even have further reported cases that we have, seen the literature of cases in these countries. So we are all over the map. HPS is really all around the world. And so it's very similar to albinism that occurs all over the place. And it's kind of important to note that because occasionally people have trouble getting a diagnosis because they are not of a particular background. Which specifically is Puerto Rican. People of Puerto Rican descent have HPS quite more frequently than every other nationality, which can cause problems when you're trying to diagnose because people think that if you're not of Puerto Rican background, there's no reason to test for Hermansky-Pudlak syndrome. I have a daughter with Hermansky-Pudlak syndrome, and I am not of Puerto Rican background at all. We are on my side, we're Irish, and way back when, we're Irish and English and French Canadian, and my husband is Italian and Maltese, so it's quite not a Puerto Rican blend, really. So in the general population, this is not people with albinism, this is the carrier rate maybe of the general population. And I have to say that HPS is so underdiagnosed that I think that this is just merely a guess of scientists, and I don't think that, this is really hard to pin. So somewhere the carrier rate between 1 in 350 to 1 in 500. So that means that myself, a carrier of HPS, I had a 1 in 350 chance to a 1 in 500 chance to be a carrier of HPS. And to meet my gorgeous husband and decide to marry and have children, and the chances of us to do that would be 1 in 125,000 people, even though he was the only one in the world for me. But the chance of then having a child with HPS would be something like 1 in 500,000. Or at the top, if I look at the carrier rate of 1 in 500 rather than 1 in 350, it would be like having a kid 1 in a million. Which I assure you, and Japan, they actually looked at cases of albinism. So they tested those cases genetically, and I think 30% of them had no definitive gene for albinism, which leads you to believe that there's a possibility that more people in that room of 100 people with albinism had HPS. Now let's look at the Puerto Rican population. The carrier rate in the Northwest, so if you take Puerto Rico and divide it into 4 quarters, that upper left-hand quarter, which has a large majority of people, there's a lot of people in that corner, it's carried 1 in 20. So it went from 1 in 500 to 1 in 20. The rate all over the island, if you mix up the entire island, it's 1 in 60. The chances of couples to meet each other, fall in love, have that baby is 1 in 400. And that means that the rate of children born with HPS is 1 in 1,600. This is kind of like where the island, these are old pictures, and I have the sense going to Puerto Rico very, very often that everybody's moved all over the island. So this is a rather old picture, but the HPS1 is in the upper left-hand area. HPS3, which is another type of albinism, had a mutation in the center of the island, and that's where HPS3 is centered. Now, people ask what's the deal with Puerto Rico? Like, why does that happen? And in genetics, it's called a founder's effect. When an area or a culture is actually somewhat isolated over billions of years, generations and generations, people just tend to marry on that island, and they end up marrying their 17th billionth cousin 25th removed, and the gene pool then propagates that particular gene. It's called a founder's effect. And it can be an island that's surrounded by water, or it can be a village surrounded by the Swiss Alps, anything that isolates you from the rest of the world, or it can be a culture that you tend to just marry within your culture. We see founder's effects in a lot of things, like, for instance, Tay-Sachs is kind of, in Jewish culture, sickle cell kind of in the black culture in Afro-Americans, and you have cystic fibrosis in the Northern European Caucasian kind of group. So the gene pool tends to be propagated just because of the way people procreate. So looking at cystic fibrosis among Caucasians, Northern Europeans, and 1 in 22 people carry the gene. So that's pretty amazing, which means that it's just as common for HPS in Puerto Rico, of Puerto Ricans. So it's a very common disorder in that nationality. So let's think about HPS. What are the characteristics of HPS? And we're going to go through each one of these so that, in a kind of quick manner, so that you can kind of be able to pick it out of a crowd, basically. Albinism, low vision, bleeding problems, colitis, and lung disease. That's the syndrome, the characteristics that can be involved in HPS. So looking at them one at a time, let's look at the albinism. The albinism in HPS is very similar to the albinism look of quote unquote, regular albinism. So people can be very, very fair, and that's, seen in my little fella on the right. But in HPS, they can also have a lot more pigment and then can be very dark, like the little girl on the left. So when you're talking about the way it looks, you're talking about phenotype. If you're talking about the gene, you're talking genotype. When you're talking about the look, you're talking phenotype. So the phenotype of the albinism in Hermansky-Pudlak syndrome can be very, very varied. It can be very fair to very dark. They are, occasionally misdiagnosed as ocular albinism, meaning the gene that causes ocular albinism. However, it's really the gene that caused Hermansky-Pudlak syndrome, and the person just has a lot of pigment. Therefore, the diagnosis is presumed to be ocular albinism because you can see the albinism in their eyes more than in their hair and their skin. Most often these people, even though they might have brown hair and brown eyes, if you put them next to the relatives in their family, they're still fairer and lighter than the rest of their family. Speaking of families, siblings within the same family can be very light or very dark. The pigmentation, the phenotype can be very varied even among siblings. So one of the things that occurs to me is that a lot of times I will get phone calls and from people questioning HPS, and they'll tell me, the doctor thinks I have Bossier type 2. And I ask if there's been any gene studies and any genetic testing, and they'll say no, just because they look like they have pigment. Well, that doesn't really help with HPS for sure, because we can go from very fair to very dark. So to me, unless you're doing genetic testing, I really caution predicting what your genes are, and find that to be a little bit discouraging. So now let's talk about the bleeding problem. And as you can tell, I skipped over the vision issues, so the albinism and the vision issues. And basically that's because there is no distinction between the albinism and the vision with HPS as any other type of albinism. So the vision issues, which are beautifully covered in and throughout NOAA, are exactly what we turn to. They have multiple pathologies, so they have the nystagmus, they have photophobia, they have, the same crossing and anatomy of the optic nerve. So everything is very similar in the vision. So we're kind of not going to focus on that. That's a pun. We're not going to focus on the vision. Anyway, when you're giving webinars, there's no laughing. I can't hear anybody laughing. But anyway, I thought that was funny. But oh, thanks, Mike. Anyway, we're going to go on to the bleeding problem. So let's think about that. We are now leaving regular quote-unquote albinism. It's the pigment and the vision issues are now where HPS then parts company, and we head towards this bleeding problem. Presently, everybody with Hermansky-Pudlak syndrome tests positive for this platelet disorder. Platelets are a part of the body, part of the bloodstream that help you clot. So they are made with the red blood cells and the white blood cells. They circulate in your blood, and their job is to help you clot. A normal platelet, because I relate everything to food, a normal platelet looks like a chocolate chip cookie. And that's the micrograph that Dr. White gave us wonderfully that's on the left-hand side of your screen. Those little dark spots, those chips on those platelets, are actually compartments kind of that are on the outside of the platelet, embedded in the platelet, that hold chemicals. And the chemicals inside those little spots are like ADP, serotonin, and calcium, among, I think, one or two more. Calcium, as you know, if you go for an x-ray, a chest x-ray, when you see the x-ray, you see your bones because the calcium is opaque. So that's why you can pick out your bones in an x-ray. Well, the same thing is having the calcium juice, the calcium chemicals inside these dense bodies, make it opaque so it gets picked up on an electron microscope as a spot, a chip on a chocolate chip cookie. In Hermansky-Pudlak syndrome, those platelets under a very strong microscope, an electron microscope, look like a butter cookie. So they're on the right-hand side of your screen. They do not have the compartments which store the chemicals. There is no chemical storage so that the platelets do not hold and carry those chemicals like the platelets on the left-hand side of your screen. What that does is a normal platelet, when it's traumatized in some way, bursts those little compartments open and the chemicals kind of spill into the bloodstream, and they are the catalyst. They trigger the clotting event. They trigger the next proceedings in the body's clotting mechanisms. They also kind of coat the outside of the platelet with like kind of crazy glue and make them all clump together. That's called platelet aggregation. In HPS platelets, there is no storage of the chemicals. Therefore, when the body's traumatized in some way, there is no spillage of chemicals that trigger anything, and they don't cause the platelets to clump, and that is the bleeding problem in HPS. It is also the diagnostic tool for Hermansky-Pudlak syndrome until we are sure that all of the genetics and genes have been found. So to date, the gold standard for testing for Hermansky-Pudlak syndrome is looking at platelets underneath an electron microscope to see if they lack dense bodies. Those dense bodies are the chocolate chips on a regular platelet. It will be probably a couple more years before we are sure that we have all the genes of HPS, and then we'll probably switch to genetic testing everyone. The population of people that it would be okay to really go after genetic testing, I believe, this is my opinion, would be people of Puerto Rican descent and people of Ashkenazi Jewish descent because they have HPS3. Those two groups of people have very good genetic testing available publicly, and so if you are of that nationality, you could just go for a gene screening, a gene test. If you are of any other nationality and heritage, it might be a little bit more presumptuous to think that you'll be sure that you get the answer genetically. And therefore, I recommend that you get screened with this blood test for the platelets and figuring out whether or not you have HPS, whether you have to even go ahead for genetic typing. Okay, so this is just a slide saying that what I really just said, that it holds the ATP, the calcium, the ADP, and that's why it's a dense body, and it causes a secondary aggregation response. So I basically explained this slide. So one wonders how people have kind of self-diagnosed. Unfortunately, to me, the standard, when a child is born with albinism, they are not routinely screened for Hermansky-Pudlak syndrome. I really kind of wish that they would be, because like I said in the beginning of this, you go off to the, pediatrician or have a fever, and then you're giving your kids Motrin and not even knowing that you could be actually making their bleeding disorder worse. So that little bit of safety issue is one of the reasons why I wish that we had people normally just screened. Everybody gets a big panel of newborn screening when the babies are born. We don't even know that they're being screened for some of the things that they're being screened for as a newborn. So I really wish that when the diagnosis of albinism comes around, that screen just is kind of automatic frequently done so that it doesn't become so burdensome in our mind and so scary and so worrisome, whether we should, whether we shouldn't. I kind of just wish that it was more routine. Be that as it may, it is not routine, so people have kind of self-diagnosed themselves, like looking through Google or, learning it wonderfully through NOAA or something like that. But they come to the attention of HPS by seeing easy bruising. So they'll have, and just a number of bruising. I think I'm showing you a picture of bruising, but it doesn't have to be a lot of bruising. It just might be unexplained bruising. It might be a bruise that you just don't understand why you got it, or in places that you don't understand. I've had people, get a bruise on their, on their back and not know why they got that, or on their like little foreheads or something. And it's just the bruises in odd places even. Nosebleeds can tend to be something that make people come forward. Dental work or tooth extractions. I get a number of people that have had their wisdom teeth pulled, and during that procedure, it then becomes known that they have a bleeding disorder. Had a little ones that had the ear tube surgery, insertion of an ear tube for infections in little ones, and that was really too drippy and bleeding too much. Spinal taps, when infants are little, if you don't have an understanding of why they have a fever and they're under 6 months old, people worry very much about meningitis and things like that, so you might have to have spinal taps. And that has shown some blood and has been the cause of the diagnosis in someone. And then you have normal, not normal, dog bites aren't really normal, but, accidents and activity and, dog bites and injury that people then discover that they have a bleeding disorder. One of the things that makes me a little sad is occasionally I'll have, the young girl who's, having trouble in school or something, and they are, thinking that they're depressed or lazy, and it ends up that they're, actually anemic from having heavy periods. People don't really understand how much blood is normal blood. Like, nobody really gets trained with that, but we have women that you go along and not realize that they have such heavy bleeding until they're anemic, and then you start to question them about how bad their menstrual cycle is, and you understand that they really didn't understand, they didn't really realize that it was as bad as it was. Childbirth. So we also get an influx of people after childbirth because that's a place that there might be excessive bleeding or surgery. So these are things that kind of make you think about, do you really want to have childbirth not knowing that you might have HPS, and it might be a good time to get a screen perhaps. I have to say that screening for HPS is certainly not for everybody. There's no reason, if you know about HPS, it might be, good enough. If you know that, there's a possibility, then if you ever need to have a surgery, then you can mention that I have never been tested for Hermansky-Pudlak syndrome. So just being equipped with the knowledge is power. It's something that you can talk about before you have your wisdom tooth pulled and mention, I've never been tested for HPS. I think I don't have it, but I've never been screened. This is just, a leg of bruises, but they, as I mentioned before, they don't have to be as many. They could just be unusual ones that are occurring in different places that you just don't know why they're there. So the most important points to remember: it's very, very serious in nature to know that your platelet count is normal. And why that's an issue is that if something should happen to you and you go to an emergency room, the normal procedure for figuring out if your platelets are okay is to just count them. So a complete blood count, a CBC, is something that they would do. So if you were, God forbid, if I had Hermansky-Pudlak syndrome and I got hit by a bus and I was bleeding all over the place, they would actually do a complete blood count, a CBC, to see if I needed to have a blood transfusion, if I bled too much and needed a blood transfusion. In that test, it actually shows how many platelets you have, and in Hermansky-Pudlak syndrome, your platelet count is perfectly normal. So there would be no suspect and no reason to give you a platelet transfusion based on the number of platelets that show up in your blood tests. And these are blood tests that occur all the time in hospitals and doctors' offices, and it's the normal routine blood test for anybody that comes in bleeding. So it's only the electron microscope that you can see that the platelets are malformed. And with that in mind, you need a platelet transfusion to correct your platelets and your clotting. So if you had a normal amount of platelets on your blood test, nobody would give you a platelet transfusion because you wouldn't need them. You have plenty. But if they knew that you had Hermansky-Pudlak syndrome, they would know that your platelets are not working, that you need somebody else's platelets to be transfused to you so that you could clot. So even more than the blood you need replaced, you actually need platelet transfusion. Some of the people have, bleeding that's a little more obvious than others, which is my next point. In Hermansky-Pudlak syndrome, I've had people think, well, I don't really have a bleeding disorder because I don't, bleed a lot. But then you start to talk to them a little bit, and you'll say, something like, well, do you bruise easy? Oh, yeah, I bruise easy, but I don't bleed a lot. So my point here is that you don't have to, it's a big bell curve of bleeding. It can be almost, barely almost normal. It doesn't have to be that severe of a bleeding disorder, all the way to the kids who have also a von Willebrand's factor. That's like a factor deficiency. So 30% of our HPSers also have that involved, and therefore they present with more bleeding than most. So there is a big bell curve of the bleeding problem, and it doesn't have to be as obvious as you think it might have to be. But we talk about this is actually caring for HPS, but you don't want to pack nosebleeds because when you remove the packing, it bleeds worse. And we talk about, when you bleed, you want to put, a gauze pad on it, but in HPS, it's better to wet that gauze because the scab, the clot that's trying to form with difficulty is very tenuous, and if you put a dry something on it and change it, it's going to make it worse. We give medications like DDAVP, and I mentioned the platelet transfusion, and above all, not to use medications that affect platelet function. So that's like aspirin and Motrin and ibuprofen, the Aleve and the Advils, the NSAIDs, Pepto-Bismol. There's a whole list, and that's why it's important to kind of know whether you have HPS, because you don't want to take these medicines if you do. The DDAVP that's on the top of the slide is a medication that can sometimes be given to support clotting, but it's something that has to be done with your physician. Some people are allergic to it, so it's not something to be done. There's nothing over the counter that you can do. So why does the albinism and the platelet problem all occur together? And basically it goes back to that HPS is a syndrome. So the melanosomes, the skin cells, and those dense bodies, that membrane of the platelet, all share membrane proteins together, and so do lysosomes. So it makes it a multi-system disorder because the proteins are shared have things in common. These cells have things in common, and that's why it affects different organ systems. So now we talk about the HPS colitis. In some cases of HPS, let's go back to that there's HPS 1 through HPS 9. So these are genetically different types of HPS. And they are types of HPS that even have different symptoms and characteristics. So not everybody with HPS will get the colitis, or up and coming in slides that are coming, the lung disease. Only specific genetic types of HPS carry the problems of maybe the colitis and the pulmonary fibrosis. So every type of HPS to date has the bleeding disorder. But we part company once again, and these are specific types of HPS. So these go to even fewer people, that might develop the colitis. It occurs in about 15% of the people with HPS, so it's even the rare of the rare. And it resembles a Crohn's disease, and it has diarrhea, cramps, and blood in your poop. This becomes a little problematic when I try to assess this in people because of their vision, and it's very hard for people with low vision to actually figure out whether there's blood in their stool. So they could actually be that person that's really being fatigued and tired and kind of never knew that they had any bleeding going on because they haven't seen it in their stool. So you kind of really need to be seen by a gastroenterologist that knows about HPS. This is just a picture of a colon. So one of the important points to remember is that you need to be seen by a gastroenterologist who actually understands Hermansky-Pudlak syndrome and has seen colonoscopies that were done on cases of HPS so that they know really what they're looking for. One of the issues here is that, unfortunately, if you go to, sometimes it has happened to people with albinism that they've had a problem with their bowels and their colon, and because of the bleeding disorder, they present to an emergency room in really bad shape and quickly go for a colectomy, like a removal of bowels, and without the doctor's understanding that there was a bleeding disorder involved. So had they received some platelets, they would have been able to hold on to their colon and not have to have surgery, because they would have had more time to get medications that routinely help colitis on board. And, it's a very sad part of the issue because there has been, quick and premature colectomies done, which I think maybe not, but maybe could have been spared, possibly. The lung disease is another part of HPS, but it only occurs in HPS 1, and we found some now in HPS 2 and HPS 4. So if you figure out you have HPS by the blood test, does not tell you what type of HPS you have. And therefore you should, try not to think about or worry about the lung disease or whatever until you are actually gene typed, because it's only then that you will know whether or not you have to worry about this at all. But that shows as a shortness of breath. It's the scarring of lung tissues, and a lot of times it's seen just as exercise intolerance, that suddenly that 1.5 miles you run in the morning is just a little harder for you to do. It's misdiagnosed as asthma and idiopathic pulmonary fibrosis often. And the pulmonary disease is certainly the concentration of a lot of our research, because we want to try to cure this disease, and we're very concentrated on research. So we have had drug trial for this, and we're very active in trying to figure this out. So there's still hope. We do help people kind of navigate through lung transplantation and things like that. So first of all, you don't know what type of HPS you have. Second of all, there are things that you can do for your pulmonary fibrosis. This is just talking about what we do know. We don't know the cause of the pulmonary fibrosis in HPS, but we do know that cells inside the lungs, like alveolar macrophages and type 2 cells, are abnormal. And they have giant lamellar bodies. This for the science audience, anybody out there that's particularly science gifted. And we also have found that surfactant protein A and B are reduced. So this is the information that we wonderfully Dr. Guccico and Dr. Gall at the NIH have been working on with Hermansky-Pudlak syndrome. And so we are getting somewhere with trying to figure out what causes this. The important points to remember are certainly don't smoke. Watch for those toxic fumes. We are thinking that there are things that trigger the fibrosis, so you want to make sure anything that could trigger scarring in the lungs be not involved. So I would want my daughter to know whether she has HPS so that I can make sure that, heavens, that she's not smoking. And, of course, Ashley gets really excited because she doesn't have to clean the bathrooms and use those toxic chemicals cleaning. She likes that part, and we protect her from having to paint when we're painting walls, and so she kind of thinks that's all pretty neat. We pretty much treat respiratory infection. We don't let her go with a cough too much. We want to make sure that we go to the pediatrician or the doctor to get some antibiotics quickly if she has any kind of upper respiratory infection. And flu and pneumonia vaccines are really important for us. We do pulmonary function testing with her often. And we certainly believe in getting involved with the National Institutes of Health in our research. So in summary, why should I learn about Hermansky-Pudlak syndrome? And I think, as we discussed, the danger of not knowing. I think it's really important to make sure that it's not one of the issues, so that you can use all of the medications available to you without worrying about having a platelet disorder, the platelet disorder being worse, and the prevention health management, so that you know what you should steer clear of. I hope that this was somewhat helpful. I am always constantly available. I love my position in NOAA on the board. I love working with Mike and the board of directors, and I love being available to anybody that has a question about anything having to do with medical issues and their albinism. I'm always available at the phone numbers that you see on your screen, and hope that this hasn't alarmed you. Remember that the vast majority, way vast majority of people with albinism do not have Hermansky-Pudlak syndrome. But, you know, I didn't expect my daughter to have it either. But I want to make sure that people know about it so that they're able to pick it up if it's in their family, or they're able to help somebody in the albinism community be cautious about it if they need to be. So, Mike, back over to you.
Thank you so much, Donna. For those of you listening and viewing this webinar, there is no more dedicated person that I have ever met to dealing with a syndrome, and I think it's safe to say that Donna has devoted a large part of her life to supporting creating and supporting the HPS network, and I think it's safe to say in the last couple of years that it has really become her primary focus in her life's work, along with raising her family and caring for her family. This concludes this webinar, and I'd like to invite those of you who have specific questions to use the information on the previous slides to contact Donna directly. The subject matter of one's health, personal health, when it comes to some of the aspects of HPS that Donna mentioned, you may be more comfortable speaking to her directly or emailing her directly rather than being part of a forum. But if you are more comfortable in that forum and you have general questions, we are scheduling a teleconference, which will be on July 12th, 2011, and that starts at 8:30 Central, or 8:30 Eastern Time, and you will receive, those of you on the NOAA mailing list will receive notification of that, and you'll be told how to register for that. To keep up to date on this webinar series and all the things that are going on in NOAA, please visit the NOAA website frequently. Currently, it's a little old and outdated, but we try to keep most of the current information there, and we're working on a rewrite of the albinism website, the NOAA website rather, and information up to date on the webinar series and teleconference series is available at NOAA's parent page, which again is displayed on your screen now. Again, thank you so much, Donna, for your dedication to the albinism community, to NOAA, and especially for your service to those with HPS. You have our heartfelt gratitude, and thanks everyone for listening today.